It's going live now.
Oh, okay. Good morning, good afternoon, good evening. I'm Dr. Unati Makiwane. I'm the medical director of the Black Mental Health Show. Here we have it on Saturday. If you have not joined us, please join us on Saturday every 4 p.m. Eastern African time. We hold these talks. These are sensitive talks that matter to us as an African descent people. This affects people in the diaspora and also in African space. But today, I don't want to waste our time. We have a special day today. We basically observe this special day, the Suicide Prevention Day. This is observed internationally. Every country observes this day. The reason why it's done that way, because suicide is a public health issue. It is something that is affecting every race, every culture, every economic state. You know, this is something that we need to talk about in Africa. And the sad part is, I would like you to understand that suicide occurs more commonly, more than the war, the homicide rates. It is very common. And as a matter of fact, in the world, we have close to 800,000 people who die by suicide every year. And the sad part in that number, 15 to 29 years old, that's the range that has the highest suicide. That's very sad and staggering. I would like us, all of us, moving forward today, to understand the impact suicide has on us. This affects every race, like I said. A lot of times in Africa, we have actually lived in this cloud behind us or in front of us, actually, thinking that depression or suicide doesn't affect us. And as a matter of fact, according to World Health Organization, it's above 70% of cases of suicide occurring in the low and middle income countries. So Africa is part of those countries. So I would like you, all of you, to understand that, as we all know, there's goals, World Health Organization and other stakeholders that are looking at by 2030, we would love to decrease suicide. Each one of us has a responsibility, plays a role. So I would like you to understand that suicide has multifactorial options, or has actually many causes that make people to commit suicide. That's where I'm going with you. Could be political reasons, social, cultural, religious. There's so many things. And you know what? In that 800,000 people that die every year, it only means that every 40 seconds, someone is committing suicide. That's very sad. And a lot of times, people that commit suicide, they've had probably 20 attempts, even by thinking about it. So what could be done about suicide? First of all, we need to understand what makes a person to commit suicide. I mentioned earlier on that we have so many factors here. There's political. Do we have control over politics? Unfortunately not. So we need to also start thinking about our mindset. A lot of times we'd love our governments to change, but these things we cannot unfortunately change overnight. That's why GPEN, that's why you are here watching me here. Change would come from you and I. All right. So I would like us to understand that people, when they get suicidal, there's usually issues that basically precede that. A lot of times there's depression. Depression, I would like to talk a little bit more about depression. If you or your friend or your relative, your parent, because like I said, this affects all ages. A child, a 7-year-old, 9-year-old, 10-year-old could be depressed. We're starting to see all this age group committing suicide. If you have symptoms of depression, which are as follows: you are unable to sleep well. It's either you're sleeping more or less, eating a little bit more or eating less. You are feeling sad, very down and depressed. All of a sudden, you don't feel worthy to be here, or you're feeling worthless. You have so much fear. These suicidal thoughts keep coming to your mind. Even your weight has changed. People are asking you what is going on. You're losing weight or you're gaining a little bit more. Just feeling sluggish, always tired. this actually happens for almost 2 weeks or even longer, kindly see your doctor or your counselor. There's many stakeholders that are able to help you. It could be a nurse, a neighbor, it could be your doctor, it could be a counselor, it could be your church member, it could be your pastor. We're starting to talk about these issues even in the church, because a lot of times in Africa, depression and suicide have been misunderstood for so many years. A lot of times, our Christian organizations or even other religions, they have misunderstood the concept of depression or suicide, and it's happening right under their roofs. So we're starting to see discussions in these organizations, which is very important for our people to understand that it could set in for any person. You could be making a lot of money, but it could happen to you. We've seen people globally, people that were supposedly millionaires and committing suicide. So suicide could happen to anybody. Like I said, it's multifactorial. And sometimes there is a genetic component. You could actually hear of your uncle, your aunt, your grandfather, your grandmother who committed suicide many years ago. Yes, it has a genetic component. So I would like each one of us here to start recognizing these symptoms and also be compassionate against each other, towards each other, so that we understand that suicide or suicidal people need the help the other person needs, a person with diabetes, a person with high blood pressure, same with people suffering from mental health struggles. So in closure, I understand that globally, all the countries have hotlines. There is help. Seek help. Speak to someone you trust. Speak to someone you could be vulnerable to. And I would like to also emphasize this. A lot of times with this pandemic, we've seen a rise in suicides. Reason being social distancing. People are in the houses. They are not able to go out and mingle, socialize like they used to. There's a lot of loneliness. People lost jobs. There's a lot of anger, loss of marriages, relationships. And a lot of times, all these things bring about anger. When actually men present with depression, a lot of times it's presented with anger and violence. We're seeing a lot of gender-based violence. We need to stop it. By stopping it, we do these awarenesses like I am doing right today. So it is my pledge. I'm pleading with all of us to start getting aware of any suicidal thoughts or depressive symptoms. We need to be aware of them. Speak up. Speak to someone you trust. Speak to someone you trust. Like I said, there's nurses you can talk to, the doctors, psychiatrists, your counseling. To treat depression, it takes up to 6 months or even longer. And sometimes people who have suicide thoughts or who commit suicide, there's usually no depression prior to that. It could be feeling defeated by life, loss of a job, loss of a loved one. So it could be things like that happened overnight, and then a person loses hope. So I would like us all to practice compassion towards each other, love, and support. In closure, I love you all. Go out there, look for someone who might be living a lonely life. You could make a difference. By doing so, you will be actually contributing to the 2030 goals that we have in the world. By 2030, we'd like to see suicide rates to lower even by a half of that 800,000 we have every year. Thank you so much for listening.